Age-related macular degeneration, also called AMD, is the leading cause of vision impairment and blindness in Americans over the age of 60. As many as 11 million Americans are estimated to be affected by some form of AMD. This number is expected to double to nearly 22 million by 2050. AMD is caused by damage to the macula, a part of the retina in the back of the eye that is responsible for central vision, color vision, and clarity. There are two forms of AMD, dry and wet. Wet AMD is the severe form of AMD and is associated with leaking blood vessels into the macula that cause blurred vision or a blind spot in the visual field. AMD leads to loss of the sharp, fine detail central vision required for activities like reading, driving, recognizing faces, and seeing the world in color. Age is the most predominant risk factor of AMD. Other risk factors include smoking and family history of AMD. At present, there is no cure for AMD. However, there are effective treatments for wet AMD that can improve vision. These include FDA-approved and off-label anti-VEGF therapies that can seal leaking blood vessels. You and your doctor can choose which therapy is right for you. Since these treatments are expensive, health insurance plans implement step therapy to keep costs down. Through step therapy, insurance companies may require you to fail the low-cost off-label anti-VEGF agent first before being approved for the more expensive FDA-approved therapies. Before you can receive your therapy, your doctor's office will send a prior authorization request stating the reasons why the prescribed treatment is right for you. These include your medical history, lab results, treatment plan, and any other relevant information. The insurance plan will review the request and make the decision whether to approve it or not. Here are some things you can do to help. Promptly provide any information requested by your doctor's office. Update your personal information with your insurance company. Complete additional paperwork if required by your insurance company. Remember, the prior authorization process may take a few days. Be sure to follow up with your doctor's office to keep track of the progress of your request. If your request is denied, it does not close all doors. Your doctor's office will appeal a denial with additional documentation, which may result in the approval of your treatment. If you receive an approval, congratulations! Your health plan has agreed to pay for your treatment. Remember to refer to the terms of your health plan to determine your out-of-pocket costs. Talk to your doctor about available co-pay assistance programs. Remember, prior authorizations are only valid for a limited time, so fill your prescriptions promptly. Ongoing treatment may require renewal of prior authorization. For renewals, your doctor will need to show that the treatment has been working for you. For more information on AMD and prior authorization, please visit www.cmeoutfitters.com/ophthalmology hub.